guys. My name is John Pontom Shukunapwe. I'm a registered nurse by profession. So, in view of the ongoing Nurses Week, I'm here to lend my voice in area of self-medication. This is one of the social problems we face within our society, and I see it as a point of duty for me to come forward to explain to you, my audience, on this trend, which is detrimental to health. So, self medication is just an art whereby an individual takes some medicinal product without official prescription by a licensed healthcare provider who is a medical doctor by training. Often, when people are sick, they try to guess what is affecting their health. And in doing this, they may just assume that they are suffering from one illness or the other and then go to the nearest chemist to procure some forms of medication in order to embark on self treatment. Most of the symptoms that people usually misdiagnose by embarking on self medication is malaria or some forms of infection, as they put it in quote. When people have some symptoms like high fever, weakness of the body, or some source of pain, they go to the nearest pharmaceutical shops to procure some analgesics or some form of antibiotics like ampiclos, paracetamol, as the case may be. By the virtue of our healthcare training, we know that some of these medications are detrimental to health in as much as it helps to treat one form of illness or the other. Take, for instance, paracetamol. Paracetamol is a highly toxic medication that is highly abused by people within the society, both old and young. Paracetamol is being detoxified by the liver, and excessive intake of paracetamol in the long run can damage the liver. Also, indiscriminate intake of antibiotics can lead to antibiotics resistance, in which when an individual is now severely sick, some of these medications will not be effective in treatment of well-known illnesses in the body. This is as a result of abuse of this medication by virtue of embarking on self-treatment. There are many factors that are contributing to this issue, so we should know about them in order to tackle them head on. One of the factors is lack of financial resources to go to the hospital. As we know that healthcare services are highly costly, especially in developing countries like Nigeria. Individuals often resort to treat themselves on the perceived signs and symptoms that they feel without consulting the expert view of a medical practitioner. This they do by just acquiring medications based on what they think within themselves that it is the disease they are suffering from. Furthermore, lack of access to highly trained professionals. Self medication is really detrimental to health because some of these medications people take without prescriptions has a lasting long-term effects on the body. If this is not curtailed, it will go a long way to lead to some severe damages within the body, like multiple organ failure or untimely death, as the case may be due to drug overdosage or drug interaction. The right approach to take when someone is sick is to visit the hospital and get diagnosed by a highly trained medical professional. Upon arrival in the hospital, you have to embark on consultation where you meet a medical doctor who will assess you based on the complaints you are presenting. This information you have provided will give him a clue to request for further laboratory investigations, which will be sent off to the lab for analysis. It is the duty of a medical laboratory scientist to run this test as requested and then send back the results to your healthcare provider, who is the medical doctor, for him to interpret and then decide on the next line of action. This approach to treatment will help to make sure that there is no issue of misdiagnosis or unintended use of medications that are not necessary to your presenting complaint. Upon interpretation by the doctor and prescription, often it is the duty of the nurses to help in administration of these medications to ensure that they are taken the way they are meant to be. Prescriptions are necessary to ensure that appropriate dosages of the medications are taken, and then within the stipulated duration of time to make sure that if they are no longer needed, they are discontinued in order to protect the vital organs of the body. It is the duty of the government to protect the healthcare of its citizens, and this can be done by provision of healthcare insurance to ensure that people can afford to visit the hospital whenever they are sick. Also, advertisement and printing of healthcare leaflets will help people to have appropriate information and motivate them to seek healthcare services when they are in need of it. Building of healthcare facilities within the rural area will go a long way to help people to visit the hospital whenever they are sick because of accessibility. In order to ensure that people obtain the treatment that they deserve when they are sick, it is also the duty of government to make sure that they embark on massive recruitment of qualified healthcare providers and also pay them what they are worth in order to make sure that highly trained people are available at every point in time to meet the healthcare needs of its citizens. It is my duty to help you to understand why it is highly important for you to visit a doctor whenever you are sick. And that is why I'm embarking on this campaign to make you understand that self medication is an evil wind that won't do you any good. I urge you, my brother, my sister, my dear parents, my audience, for you to try visit the hospital whenever you are sick because appropriate diagnosis will lead to appropriate treatment. Self medication will not help you in the long run, rather, it will be detrimental to your health, which will lead to multiple organ failure, as the case may be. Once again, my name is John Paul Ntomshukunakwe. I just pray that you will do the right thing when next you are sick by visiting the hospital in order to be attended to by a highly qualified healthcare practitioner. Thank you as you do the right thing.